I'm Sue O'Shea. I'm one of the midwives that works in birthing unit and also the maternity unit. So hopefully I'll see you here one day soon to have your baby. Today I've got Katie and Ben as our lovely models, and we're just going to talk through some of the medical pain relief options that you might want to use through labour. Relaxation is beneficial for labour as described in Module 2. However, this can become increasingly difficult as the labour progresses. So it's beneficial to know what your options are to help you get through the labour and to continue that relaxation. So they're very useful tools in assisting the labour throughout the stages. They don't have to be given in any sequential order, and your midwife will assist you to determine what the options are at that particular time and just guide you through your labour and what might be best at that particular stage of your labour. So the first is nitrous oxide, and it's known as Entonox and air. So the important part about nitrous oxide is to find a nice comfortable position. And do you feel okay in that position, Katie?
I do, yes.
And to get the dad involved too, as far as being able to help Katie with breathing. So Ben, probably bringing the bed up to a position a little bit higher for Katie. And if you come forward, and we can pop that pillow down around your belly. So what nitrous does help with is to focus on the breathing. And the breathing does need to keep to a rhythm. So we're going to hold on to the gas, and I'm going to instruct Katie that when you start to feel the contraction come on, that's the time you need to put the mouthpiece into your mouth and to suck very deeply right down the centre of your body, right down to the base, and as you breathe out, to relax from the bottom up. So Ben, what I need you to do is to have a seat there behind Katie, and you might find that just giving a gentle back rub through the contraction when Katie's having breathing on the nitrous oxide might be helpful. Katie will tell you when she's not happy with you doing that. She'll pop the hand up or she'll say stop, but she'll indicate when what you're doing is not helping. But otherwise, it can be very beneficial with the contraction, or even just a gentle pressure on the back through the contraction. So Katie, take a nice big deep breath as you start to feel the contraction come, and big blow out. So when you suck in, imagine you're sucking it right down deep, and as you blow out, let all those muscles relax. We just keep that rhythm going. So as you can see, it just gets that control back when you're starting to get to a stage through the labour where that body's starting to get a little bit tense. Well done, Katie. And after the contraction's gone, we're just going to pop your head down and relax. So it can cause a bit of dizziness and lightheadedness, and especially after the first intake of the gas, but the body does start to relax and accept that feeling. For some ladies, they don't enjoy that feeling, and it mightn't be the choice for you after a couple of breaths of trying. After long-term use, you can have a little bit of nausea and even a dry mouth. The other way we can use the gas is in the bath. So the benefit of the gas also is you can use it in conjunction with the nice warm water and use it in the bath. And Ben can keep Katie cool with the cool compresses, as well as assist her with her breathing through the contractions. So Katie, as your labour progresses and contractions are getting stronger, you might feel like the gas isn't doing it for you anymore, and you might need something stronger. So at that stage, we might need to do an examination and just see where you're at and what might be the best option for you next. One of the next options that we could give Katie is a morphine injection, which is a narcotic, and it's given by an intramuscular injection or a subcutaneous injection, which is just into the skin. It takes effect within about 15 minutes, only takes about 4 hours to last, and it can be repeated if needed. It does help to relax, especially between contractions, and you probably will go off to sleep. However, with the morphine, you can't use it once you've had the morphine, you won't be able to get into the bath unless those 4 hours have passed. So some of the effects of morphine might be nausea. So it's given in conjunction with an antiemetic drug, which is an anti-nausea drug, and it does cross the placenta, but when timed, it can be very effective. So that's why a vaginal examination is done beforehand, just so that we know where you're at and how soon your baby might be delivered. So the next option for pain relief would be an epidural. It's an injection into the back, into the space in the lower back, and it's a mixture of local anaesthetic and narcotic. It's the space where the nerves run and supply the legs, the uterus and the abdomen. A fine tubing is fed into the space and giving continuous controlled pain relief and the experience of pressure with the contractions but no pain. It's always performed by a specialist anaesthetist. So it takes about half an hour for the procedure, and it can lower your blood pressure, so we need to have a drip in place running here. And I'm going to run the fluid in, and that will just give your body a bit of extra fluid so that if you do have a drop in your blood pressure, it compensates for that. You'll also need a urinary catheter because you won't be able to feel to get up and out of bed and to pass urine. There's risks associated with the procedure, but these are rare, and the anaesthetist will explain these to you at the commence of the procedure. The epidural allows for sleep, so it'll have no effect on the baby or your mental state, and you'll be able to rest between contractions. You won't feel the contractions, but you may feel the pressure. So for the best position for the insertion of the epidural is for Katie to be nice and relaxed on the bed, pillows up underneath the arms, round the shoulders, and Katie, I want you to push your back out from here. And by that way, you're opening up the space between the vertebrae. And Ben, I want you to just stand in front of Katie and just pop your hands onto her shoulders on either side so she can lean against you. So once the epidural's in place, Katie's able to rest comfortably. You can still have your music going, create your lighting, create your environment, and be nice and relaxed. So what we've got in place is the continuous monitoring, which has to be in place with an epidural. We've got the IV line going, and we also have a catheter, which is just continuously draining the bladder throughout her labour and allows for rest. So Katie will turn every couple of hours, and we will assess every couple of hours to make sure that the progress of the labour is happening.